The patient has autoimmune encephalitis. This is well established by the right measurement of antibodies in the cerebrospinal fluid. Remember that blood is not enough. It leads to a lot of false positive, but mostly false negative results. And in this case, we measure in the cerebrospinal fluid through a lumbar puncture. By means of the molecular imaging, we are able to see that the patient before treatment has a severe case of hypermetabolism in both frontal cortices, more severely in the right frontal cortex. After the treatment, in this case immunotherapy, we can see a normalization in the metabolism. This is one of the cases in which I can show both resources of molecular imaging of FDG-PET scans. In the upper image, we see the normal aspect of the PET scans. We see here the hypermetabolism at the frontal lobes, but also hypometabolism in the occipital lobes. But below, we have a transformed image, which is the SENIUM technology image, that compares the case automatically by a process of automatization through brain informatics, and we compare the case to healthy subjects, control subjects, so to speak. That's why we can see a more pronounced abnormality in the frontal lobes in the lower images, which are the transformed or statistical imaging. After the treatment, we can see that the frontal lobes are normalized and also the occipital cortex corrects. So in this case, molecular imaging helps in two ways. First, it can lead us to a better diagnosis, but also to the development of scientific hypotheses to understand the clinical aspect of the case, which was very severe, the delusion of being deaf, the so-called nihilistic delusions. And these nihilistic delusions can be very severe behaviorally because this patient paradoxically tried to commit suicide. He thought that he was not alive anymore, but trapped in some sort of eternity where he was in perpetual suffering. So he tried to commit suicide. These contradictions are part of the irrationality that is the core features of delusions. Fortunately, the patient improved significantly.